So, which brings me to doing the work on the ground. All of that has been it's taken us a year to get there with our strategic plan, because it's just all of our time has really been spent on continuing to respond to COVID. Like Dr. Gleason mentioned, monkeypox, we currently, knock on wood, have not had any monkeypox cases in the month of September in Milwaukee. And now really we're faced with polio. And I've been asking my epi team to pull data and numbers, and frankly, I know polio is something that's really important to Rotary. When I was a Peace Corps volunteer 25 years ago, I worked in a polio eradication effort in Mali and literally brought vaccine to people's houses. And I never thought that I'd be standing in front of a group of people 25 years later talking about polio in the city in Wisconsin, in the United States. But we have vaccination rate of polio at 70%, just over 70% in the city of Milwaukee. We have pockets in the city that are under 40% vaccinated. So we've been working really closely with our school partners, our private and public schools, to encourage more children to get vaccinated. But this issue of people being concerned about this sort of anti-vax effort is going to get us. That we are going to end up with children who are hospitalized with polio, which is a preventable disease and can cause significant disability and death. And I'm very nervous. I mean, we see what's happening in New York. It's only a matter of time before we have it here. And again, we have pockets of our population that are really under-vaccinated, significantly under-vaccinated. So that's what my team's working on now, trying to think about how do we prevent that, really trying to increase our vaccination rates. We're working with our healthcare partners. The Milwaukee Healthcare Partnership's been a tremendous ally and advocate for us. But similarly, in your workspaces, if you work with families or if you work with children in any way, please encourage people to get them caught up on their childhood vaccinations. We really are faced with some, I'm fearful of what this can mean for us. With that, questions?
Thank you very much, Kirsten. I'll bet in this room we're running a 98% polio vaccine rate because we were all vaccinated in the 50s. Does that vaccine still provide us protection?
That's a good question. Actually, I'm going to turn it back to you, Dr. Gleason. My understanding is that it does. Yes, my understanding is it does. But polio vaccine is usually given to children at birth, so at 2 months, 6 months, and then all the way up to age 6. It's a 4-part series, and we know children oftentimes are caught up in some time up until 2, but then when they get enrolled to school, they should be all the way caught up. But again, over the past 2 years, I think we're also at more risk because kids just haven't been going to the doctor because of the pandemic. So we have a gap of kids who have not seen their primary care providers and are not caught up on their vaccine.